to you about the surgery called an anterior cervical discectomy and fusion, or ACDF. The details of that surgery are that I bring you into the hospital, take you to the operating room, you get put to sleep. The first thing we do is we hook you up to neurological monitoring, meaning there's an outside outfit that comes in and a guy hooks you up to wires. During surgery, they are testing those nerves continuously, both your spinal cord and the nerves. It's just to make sure that all the nerves are happy during surgery. It's basically an extra layer of safety. I make an incision right here in your neck. I usually try to hide it in the skin fold so that you have a good cosmetic result when we're finished. I then dissect down until we can see the front of the spine, kind of between my thumbs. Then I bring in the microscope, and under a microscope I drill out that bad disc all the way down until I remove the bone spur. That's why we're there, is to remove the bone spur, and I don't leave until it's done. That is the guts of the surgery, and why we were there was to unpinch the spinal cord. The way that I do it is I put a little plastic O-ring in there. That O-ring is filled up with some crushed up bone material. The O-ring serves two purposes. The first is it's a tube that allows the bones to grow together. The second is it's a shim that keeps those bones nice and separated rather than collapsed. And the last thing I do is I put a little plate on the front, similar to that one. That plate acts like an internal neck brace, so it keeps those bones still. Bones have to be still to want to grow together. The risks of surgery are small but real. Bleeding, infection, weakness, numbness. Most people have a lump in their throat feeling after surgery. That's from a combination of me pulling on your throat as well as having a breathing tube, and that goes away 99% of the time. The sac that holds the nerve can get a hole in it and leak spinal fluid. It's exceedingly rare. If that happens, I fix it. If your neck is quite sore, because I make you taller, because that disc has collapsed and I go ahead and restore its height. So people complain of a lot of tightness back there. But that goes away 99% of the time as well. It takes me about an hour. You spend one night in the hospital. I leave a drain that comes out the next morning. Typically go home the next, on the first day after surgery. Take it easy for a couple weeks. We try to clip your wings for 2 weeks. We just ask that you walk around and eat. And we see you back in clinic at 2 weeks. At that point, we let you increase your activity as tolerated. You basically can start driving again, lifting up to about 20 pounds. We follow you for a total of 3 months. Once you've completely healed up, you don't have any restrictions. You can golf, shoot guns, ride horses, whatever it is you like to do.